Stroke assessment. An accurate history is an important feature in looking at the diagnosis of a stroke. When you're taking a patient's history who is experiencing signs of a stroke, you want to ask, when did the symptoms start? Have they had these symptoms before? Do they have a history of a stroke? Because remember that a stroke symptoms can appear anytime and depend on the location and the extent of the ischemia and what arteries are involved to what symptoms the patient will present with. So it's important to know when these symptoms started and to know have they had these symptoms before. Chart 45-3 gives a good overview of this to look at the arteries involved and what signs and symptoms the patient may present. I do not expect you to know that chart to any extent at all. I do just expect you to have looked at it to get an idea of the when the different arteries are involved where the signs and symptoms can occur. I do expect you to know the 5 most common symptoms of a stroke, including sudden onset of confusion or difficulty speaking, any type of trouble seeing, whether it's double vision or inability to see out of one or both eyes, dizziness or trouble walking, and a sudden headache of unknown cause. I do expect you to know the 5 common symptoms of a stroke, and that the first priority is to get the patient to a certified stroke center. The National Institute of Health Stroke Scale is a commonly used, valid, and reliable tool that is used for the assessment of patients in the emergency department by nurses. And it looks at 11 different areas, including level of consciousness, gaze, vision, whether or not they have facial palsy. They look at motor movement of both arms and legs. They look at sensory. They look at their speech. They look to see if the patient has dysarthria, and to the extension and to intention, or if they have neglect. I don't expect you to know those either, but I would like you to read through what is looked at in the emergency room, emergency department by the nurses using this National Institute of Health Stroke Scale. In order to administer this scale, the nurses have to be trained on the exact use of it, and there's a booklet that is given when they pass the test to be able to administer this assessment. And it shows pictures of what the assessment should look like to see what points the patient gets. But I do just want you to again look at that because this scale, the National Institute of Health Stroke Scale, is one of the assessment tools used to determine if the patient is eligible for thrombolytics or not. So it's very important to see if the patient can have treatments done that could reverse the stroke. Now, once the patient is out of the acute care setting, or at least out of the emergency department and out of critical care, they usually will just use a Glasgow Coma Scale to continue to monitor for neurological assessment. But while the patient is in both the emergency department and in critical care, they tend to use this National Institute of Health Stroke Scale to determine where the patient, if they're making progress, especially if they've had the fibrolytics done. Are they seeing reversals of deficits that they were once presenting with? But that's really going to be covered in a lot more detail next semester. But I did just kind of want to go over a little bit of that with you, but I won't test you on that. I will test you on the 5 most common symptoms of a stroke. I will test you on knowing that the first priority is to get a patient to a stroke center, and that there is a scale that looks at 11 different areas not necessarily what the loading areas are, but that there is a special scale that is used by nurses in the emergency department, and it is one of the assessments to determine if a patient is eligible for fibrinolytics to see if they can reverse the effects of the stroke. Here we're continuing with the assessment of the patient with a stroke. We're looking at cognitive and motor changes. If the patient's stroke has affected the right side of their brain, they are generally have problems with vision, spatial awareness. They are usually disoriented to time and place. A lot of times they're impulsive or have poor judgment. They'll act like they haven't had anything go wrong with them, which is very interesting. They'll have trouble with left hemiplegia, inability to move that left side. You'll see that with injury to the right side of the brain. Language is usually on their dominant side. Say for the majority of the world, that's the left side. Controls our language and mathematics skills, analytical thinking. They'll a lot of times have aphasia, which is very difficult because they may know the word or they may think they're saying the word, but they're not, which is very interesting. They can have some problems with dyslexia where they're turning words and numbers around. And they'll also have that right-sided weakness or paralysis. During the acute phase of a stroke, some of the diagnostic testing the patient will have are lab works for an H&H, a white blood cell count. They'll have cardiac enzymes, PTINR, a PTT. They'll also have imaging testing, a CT scan to see where the ischemia is, and if you can see whether or not it's a bleed or whether it's a narrowing. They also may have MRI or MRA done. They'll usually have an ultrasound of their carotids. They'll have ECG or an ECG performed, and sometimes an echocardiogram to see if there's some valvular problems that may be causing a thrombus. So again, continuing with the assessment of the patient with a stroke, these patients are usually older than 65 years of age. Most of the time they have hypertension. After the stroke, they'll have varying degrees of immobility, and you need to be able to assess to their reaction to the event. Sometimes they will have emotional lability, which is where they have an uncontrolled emotional state. A lot of times you see this especially with frontal or right-sided injury. They will be very tearful. Their emotions will be out of context. They may weep uncontrollably for something that is only very minor. Their laughter may not be conducive to what's going on in the room. They're just a lot of times unable to control their emotions. A lot of times their families have trouble with it because sweet little ladies who've never used a curse word in their lives will start cursing. A lot of times, especially men will get very angry and very ugly. But this emotional liability is important for the caregivers to teach the family that it's not their loved one, it's the effects of the stroke causing this emotional liability or uncontrolled emotional state. One of the main goals in the emergency department of a stroke center is to get the patient for the fibrinolytics therapy or to have other interventions done. And this is to improve cerebral perfusion and decrease the effects of the stroke. These will both be discussed in detail in 495. So what we're going to be discussing in the next video is the care of the patient who has had a stroke and perhaps did not get to the hospital in time for the fibrinolytic therapy or was not a candidate for endovascularization and has had more permanent damage from their stroke and their long-term care. So that will be covered in our next video. But our main goals so far for our video series on strokes is I want to make sure that we looked at the community posters so that we know the risk factors for stroke and how to respond to them. Look at them from a side of if you are teaching out in the community, what you would need to tell community members about a stroke. We want to look at the 5 common symptoms of a stroke, because perhaps you're working as a nurse in a a pediatric unit, and a grandmother non-COVID comes up to see a baby or a toddler, and she starts presenting with a stroke. You would still need to know what to do to be able to help her improve that cerebral function. And it's knowing those 5 common symptoms of a stroke and the BFAST scale to get the patient to a stroke center so that they can have the reperfusion therapy. So we will be discussing the nursing interventions for the patient with deficit from their stroke in the next video.